So Cēsis municipality is quite a large municipality in Latvian scale. So the population is around 40,000 inhabitants, and it's just 165 kilometers approximately from Tartu. We love to visit our neighbors in Estonia a lot. So when we look at the challenges in this municipality, we see already at the social level quite a few of them. As the Cēsis municipality development program recognizes that there is this widening income gap, challenges in social cohesion, also challenges in integrating the socially vulnerable people, and digital literacy as one of the other challenges. And to address those challenges, the Cēsis Social Services Department work with 23 target groups. And we realized that in our project, we were addressing around 7 of those groups. So those were long-term unemployed inhabitants, people with addictions, people with disabilities, young people, people past working age, people with mental health conditions, and those living in poverty. And although we see that there are significant data gaps, we can't fully present numbers for each of those target groups, but we see that data that we do have already shows that these groups form a significant share of the general population of the municipality. So the project had really a good chance for significant impact. Just a couple of words on the prehistory. In 2022, the museums of the municipality already carried out their own little pilot project, Museums on Prescription, that was basically inspired by an experiment and a research paper in the UK, Museums on Prescription, on the left side. And we really wanted to reach out to vulnerable groups of people in the municipality to support them. But I must say that this pilot was lacking something. We didn't really manage to reach the audiences that we were aiming at. But thanks to this activity, we were noticed and invited to take part in this Interreg Baltic Sea Region project that developed the AOP Baltic model, and that also had higher ambitions than our little pilot. So it aimed at key employees in municipalities and regions and wanted to equip them with insights, knowledge, and to foster informed decision making. So we were really able to be more ambitious and also better equipped. This model was already presented in several visualizations, and we also worked with the same model along with the rest of the piloting partners that are mentioned on the left side. And we also, of course, were training our team using the AOP guide that is available online for everyone and was already introduced by NTPHS. So what came out of this localization of the Baltic Sea model? First of all, I must say that at the implementation level, the main implementers were Department of Culture of the municipality, that is supervising and managing all the cultural institutions of the municipality. And later on, it was transferred to Cēsis Museum. It was a more relevant implementer actually, because Cēsis Museum is managing all the museums of the municipality that were involved in the program. And then we reached out to potential referral channels, as we call them in this model, State Employment Agency branch in our municipality, Rehabilitation Center Ligatne that has an elderly care home, Cēsis Hospital that again overviews all the medical institutions of the municipality, and Cēsis Social Services Department. And I must say we were very surprised that all of these institutions actually did agree to become our referral channels. And they not only agreed, but this wonderful woman, director of Cēsis Hospital, interrupted our presentations of WHO graphs and evidence, saying, "We know about these studies. Stop trying to persuade us. Tell us how we can make it happen. And that on this very positive note, we started collaboration. And one significant difference among other piloting partners in Cēsis was that because of this quite huge variety in terms of referral channels, we also decided together to work with a diverse group of participants. Instead of choosing one age group or similar social backgrounds or similar health challenges, we had mixed group of older people from the rehabilitation center. We could also have in the same group burnout health professionals, also young people, teenagers who are struggling with behavior challenges and school attendance, etc. Another key success indicator and moment was finding the right link worker. And as Ulla Karin already mentioned, it is a really key person in this model. It is a person that links the two sectors, but also accompanies each participant at every activity. And it is the trusted person for each individual participant. And we were very lucky to find this person, Vibe, who is a long-term social worker, but also now recently joined the museum, so she knows very well both sectors and local inhabitants, in many times also in person. So, in short about our activity, and as we go, you will also visit through these photos the museums that they were going to. Our participants were 16 plus years old, not really 100 years old, but I think the oldest one was 94. So those were mixed groups, as I said previously, from 12 to 15 participants, and the key feature, key challenge that we were looking at was mild to moderate mental health problems. The program consisted of minimum 8 weeks plus one introductory meeting. So those were in total 12 to 16 activities, so approximately 4 activities per museum. And we were bringing the group to the museum, collecting them where they were at their homes with a little bus and bringing them to those 4 museums each time. As the manual says, we required at least 3 different types of creative activities. So we had 5. And the choices were based on museum's collection. So those were visual arts, creative writing, music, theater, and traditional crafts. We had quite an extensive evaluation in the project. We were very lucky to have 3 universities supporting us with relevant tools. So we had 3 online surveys and then a follow-up survey 3 months after the program. After each meeting, participants were writing little written feedback, and then there was quite a long focus group interview as part of the qualitative study that was held at the end of the program. So what were the outcomes, the main outcomes of this program? First of all, the first and most logical outcome was the improved mental well-being of the participants. That was our main goal, and that was definitely achieved. And here in the following slides, you will be able also to see the participants. The social and health services admitted that this program reduced burden on their shoulders as they were supported with this program, offering more activities to their clients, and our referral channels really express gratitude to this program because they often lack ideas and offers to their clients. Thanks to those mixed groups, we could observe a social inclusion and better social climate locally, because people who sometimes lived their lives in quite closed silos, they were meeting, they were learning about each other, and very beautiful friendships were also forged during the program. When we look at the museums, we could really observe a big improvement in terms of accessibility, because meeting these audiences also helped museums to understand their needs and the barriers that they had, so they were able to improve significantly their services. And the local artists, of course, and craftsmen and women appreciated new job opportunities that this program was very consistently offering. And you might know that especially in rural areas, artists are struggling with opportunities for professional work in their field. And it didn't end with this pilot phase. There are some very positive developments at the municipality level after it. So first, we were very lucky to host the Latvian National Conference on Culture and Health, highlighting the experience of this project in Cēsis. And it really attracted a huge interest. We really felt that there was a momentum at national level to introduce these concepts and these developments. We had 100 participants in person and over 2,000 participants online. And we managed to get our national policymakers to participate in the conference. Also, in terms of funding, the municipality saw the positive impacts of the program. And for this year, dedicated a modest but still an important funding so that we don't have an interruption in the program and we can carry on. And also, municipality made us quite crucial decision to apply for a long-term funding and build it entirely on the Museums on Prescription program, which was successful. This application was successful. And so the funding for this program, which includes also capacity building and national level awareness raising, will be carried out from 26 to 29. And finally, the municipality agreed to host and to support an NGO, Association Culture and Health Latvia, that I'm also representing today. This association is registered in one of the museums of the program Museums on Prescription. It has not only local but also national level. We are carrying out the Museums on Prescription in the municipality, but also offering training, doing fundraising, implementing projects, carrying out advocacy activities, starting a research project and doing networking, both at this local, national, and actually also at international level. And at the moment, this NGO is also the coordinator of the Interministerial Working Group on Culture and Health that unites specialists, employees of the Ministries of Culture and Health and works on the national policy for culture and health. So we see that this individual initiative that was started by enthusiastic museum employees of the municipality grew into something more consistent and permanent at municipality level. Then social and health institutions joined, and thanks to project, we were able to continue sustainable funding. So from this Interreg project to municipality project to the next EU-funded, co-funded project. And also by founding and registering this Association Culture and Health Latvia at the municipality, we moved also to national ideas and national impact. So answering to the question that the head of the Cēsis hospital asked, how shall we make it happen? We made it happen together by joining our forces, by really making this cross-sector cooperation on reality on the ground. Thank you so much for your attention, and I'm more than happy to answer questions.